Head and neck cancer is generally a very aggressive disease and requires expert care. The CU Cancer Center specializes in the disease. However, it is difficult for some members of our community, specifically the Hispanic population, to receive care and participate in beneficial clinical trials. I'm a CU Medicine provider and director of the Head and Neck Trials Group and Developmental Therapeutics Program at the CU Cancer Center, Dr. Antonio Jimeno, who's working to understand reasons behind the disparities and find ways to better serve these underserved patients, including opening a clinic, which we'll talk about. So first, you're co-investigator on a study to address barriers in cancer healthcare and improve outcomes to these underserved and underrepresented populations. This started with head and neck cancer. Tell me a little bit about that and talk more about the goals of the study you have going on.
We have very convincing data that patients that are from underrepresented minorities or that have barriers with their language have difficulty accessing the full spectrum of cancer care. In particular, the area of clinical trials that bring so much benefit to our community. So in understanding those barriers, we came to the realization that we needed to do a better job adjusting to our patients' needs. And therefore, we initiated a pilot program with the support of both the Cancer Center and the National Cancer Institute that provided funding through a pilot grant so that we could, A, understand what the needs are of those patients in our community in Colorado, and B, streamline their access to care. We initiated a clinic so that we could bring those patients at all stages of their disease to participate in clinical trials in head and neck cancer with the hope of improving either their cure rate or their survival and their length of life, and always their quality of life.
Yes, you mentioned it started with head and neck cancer. Are there plans to expand this to other patients with other types of cancers?
That's a great point. In fact, the Cancer Center, having seen the scope of this, has put the means and the support so that we actually can expand the access of this clinic to patients, not just limited to head and neck cancers, but to other patients with cancer that are in need of clinical trials.
The Esperanza en Español Clinic, which translates to hope in Spanish, is now open. It's a pilot clinic, part of your study. What kind of care can patients receive that go there?
A patient can inquire about clinical trial opportunities for them. They can actually phone 720-598-2276. That call is then put into the clinical trials clinic, and a bicultural and bilingual staff, including from schedulers to medical assistants, nurses, and physicians, will take care of seeing what are the clinical trial options available to that patient, bring them to clinic, and offer that clinical trial.